We're in Chapter 6, and this is video number 9. We're in the Manipulated Mind by Denise Wynn. It is an interesting paradox that most people treasure the concept of free choice, verbally defend it, or actively pretend to assume it, as in the case of the soldiers who marched to the bathroom, yet in reality do all to avoid it. Zimbardo believes that an illusion of personal invulnerability effectively works against the taking of control of one's own life, and works for any agents who would take control of it for you. Such beliefs as others could be made to do that but not me, and others could be swayed by speeches but not me, are dangerous because they set us apart from other people who are like ourselves, and therefore prevent us from learning from their experience what may be valuable for ourselves. Zimbardo compounds the point in his introduction to Influencing Attitudes and Changing Behavior. Be forewarned that in this text we are actively attempting to reshape your thinking about the sense of invulnerability. We believe you can be more often master of your own destiny if you learn to identify potential or existing sources of influence. We know we have set a difficult task for ourselves because research tells us that you are likely to ignore information about how the majority of people in a given situation react, and to favor information about the isolated cases that fit your preconceptions or personal preferences. It is no doubt very true that we never consider that we are the majority that wouldn't rush to the help of someone in an emergency or that would give electric shocks to an innocent party. We instead absolve ourselves from the collective responsibility of such findings by saying, I wouldn't have done that, and that is yet another example of cognitive dissonance at work. The placebo effect. The power of belief is a remarkable force for changing the expected or normal course of events. Often enough unknown to the believer, many are the tales told of members of primitive tribes who, once told by a witch doctor that they will die, or once cursed by an enemy, proceed to die when there is no physiological indication of imminent death. Similarly, belief in the spiritual healing process can effect a cure for even intransigent diseases. While it is not the aim here to debate the contribution of the healer himself, it is worth quoting one case in which a doctor told 3 extremely ill women that a remarkable faith healer could cure them by absent healing. He built up their expectations and told them the time of the day that the healer would be set to work. No healer set to work, but after the appointed time all 3 women showed dramatic improvement. One, who had never recovered from a major operation on the stomach and had dwindled to nothing in weight, made a permanent recovery. Another had suffered chronic inflammation of the gallbladder. Her symptoms disappeared for years. The third, who was dying painfully of cancer, lost all her symptoms and was trouble-free until her death. Such belief has its uses in traditional medicine. Biologically inert substances, properly called placebos, colloquially known as sugar pills, can effect cures as efficiently as pharmacologically active drugs. Placebos are commonly used in drug testing. One set of patients are given a real drug, the other an inactive substance. If the patients who take the real drug improve, and the patients who take the placebo don't, the improvement can safely be attributed to the drug and not to other factors. However, here human nature comes in to confuse the issue. Many people known as placebo reactors also demonstrate the desired improvements without the benefits of any chemical agents. The expectation that a sugar pill will induce the effects a doctor claims for it can lead to some bizarre physiological contradictions. For instance, a man suffering from severe nausea was given a drug that would normally induce vomiting. However, he was told that it would cure his vomiting, and it did. Some people who are given placebos even claim to suffer side effects as well as improvements, and some people given red, yellow, and blue placebos to try as a headache cure reported back that only one color pill worked. The most popularly effective placebo was the red one. People who are placebo reactors have been found in research to be more neurotic, suggestible, and submissive than non-reactors. In Persuasion and Healing, Jerome Frank says, since a placebo is inert, its beneficial effects must lie in its symbolic power. The most likely supposition is that it gains its potency through being a tangible symbol of the physician's role as a healer. Once again, we need to believe that someone is in charge. Believing in a healer may well serve to reduce anxiety about one's condition, and as the conditions that respond best to placebos are those where bodily pain may be aggravated by anxiety and tension, this would tend to imply that placebo power is the power to allay the kind of stress symptoms which may prevent the body's own healing processes from getting to work. It makes all the more sense when one considers that more and more diseases are now seen as stress-induced in the first place. Frank mentions the placebo treatment of warts. The warts are painted with a bright dye, and the patient is told that when the dye wears off, the warts will be gone. Here the success rate, which is high, may be attributed to the physiological effects of the power of belief. The emotional reaction to the placebo treatment with the expectation of cure causes a change in the physiology of the skin, which creates an environment no longer conducive to the virus that causes warts. Electroconvulsive therapy for the treatment of depression, the vital ingredient of which, according to Sargent, is the current through the brain that induces a convulsion, can work just as effectively without any current at all. An English doctor discovered that his ECT machine hadn't been functioning for 2 years, although it was thought to be working and consequently used every day. The patients had improved in accordance with expectation, both their own and their doctors, yet nothing had happened at all. The finding that the ambience of the ECT treatment might be the potent factor, not the shock, was later confirmed in a controlled trial. Placebo treatment is mentioned here to demonstrate the very real effects of suggestibility, expectation, and belief, which can be manifested in many different sorts of circumstances, not just medical. It was earlier mentioned that a belief in the power of hypnosis was sufficient to make it work. One's own mental state can therefore significantly affect the outcome of events and impose its own order on an environment. While this, in some circumstances, may be a strength to be capitalized on, it may also be a vulnerability that others can take advantage of. Again, only by questioning assumptions one can isolate causes from effects. Okay, I'm going to stop it right there. That was video number 9. We're in chapter 6 of The Manipulated Mind.